suffer from lower back pain? Poor lifestyle choices like smoking, lack of regular exercise, bad food habits, incorrect posture, and many others may be to blame. The pain you feel in your back is most oftentimes caused by having what's known as a slip disc. A slip disc is basically a bulge on one of the discs that are between the tiny vertebrae in your back. Poor lifestyle choices and back trauma are the primary reasons for this condition. When the disc bulges out far enough to press on the nerve, it causes pain, sometimes more severe than others. Pain radiating to the hips, back of the knee, heel, and toes are all pretty common. If you're suffering from lower back pain, the bottom line is that you just cannot neglect it any longer. Good chiropractic care will help you finally find the relief you need and live the pain-free life you deserve. We have years of experience and thousands of satisfied patients. We would love to reduce your pain and have you be our next happy patient. Contact us today.
All right, so tell me what's going on.
My neck, my shoulder,
Which shoulder?
left and right.
Mm-hmm.
So my neck is always feels like it cannot carry my head.
Mm-hmm.
It feels always very tired. My shoulder, anytime I do work where it's the same motion,
Mhm.
where I have to lift up my arm, let's say painting, it could be in a few minutes, I cannot hold up my arm to do it anymore.
Okay.
My hand always has a problem with same type of work too. I have really bad lower back problem ever since this is about 20 years already.
Okay.
I cannot sit too long, I cannot drive too long. Once I lay in bed at night, it ache. I had to twist and turn and find, it's very hard to find a comfortable position to sleep.
Okay.
I can't sleep well, it's because of back aching, back pain. My 2 feet, my calf, when I walk too much, stand too much, it gets very tired. At the middle of the night, when I get up and use the restroom, I can feel my heel hurts really badly.
Okay.
It's been really painful around the ankle too. So I am massaging myself to help a bit. So now my hip also have a problem. I sleep on very hard surface bed, like a Japanese futon bed. I lay left and right. I feel, I know exactly where the painful spots are. And sometimes I massage it, and a bruise will come out. But basically, like for example, here's tightened too. So yeah, I just have a hard time sitting and
Have you ever had chiropractic care before?
many years ago. Only like I went in like 2-3 times and that's it.
Okay, so what's the level of pain in your neck? 1 to 10?
9.
9. That's not good. And low back?
Oh, 10.
10. And shoulders?
Shoulder, I would give it a 9 too.
That's too much pain.
Yeah, I don't sleep well. I don't sleep.
So you don't get rest.
Yeah, I tried Chinese chiropractor.
You mean acupuncture?
I tried that before too. But Chinese chiropractor, like really crack your bone, your neck. I've done those many times.
Okay,
But I
really
feel
help?
well because I feel like every time I go in, when he cracked my back, one side will pop, the other side would never pop.
Okay. All right, let's see what's going on. Try to fix you. And since we helped your brother, let's see if we can help you.
Yeah. Thank you.
Let's see what's going on. Okay, so if I'm gonna do some examination, if it hurts, just let me know, okay? Okay.
Before I can turn and look.
Yeah, it doesn't move. Hurts right there?
Yep.
Okay. Hurts right here?
Yeah.
Okay. Look straight. Any pain in your mid back?
Yes.
Right here? Yes. Okay. Bend forward, please. Okay, look.
Yeah, this area hurts a
Right
lot.
side.
Left and right. I know.
So
I
the
know.
problem is on the right. Okay,
Oh.
stand up, please.
Stand up.
Yeah, face the window. Close your eyes and march in one place. 1, 2, 1, 2. Okay, stop. Don't move. Yeah. So too much labor. So you work at the grocery store, right?
Yeah. Well, I've been the past 4 years. I've been doing really light now, but
Mhm.
still, probably I started out too long ago.
Yeah. Go ahead, hold this up. I'll be right back. Okay. So basically, have a seat, please. So your body at this point, move to the left a little bit. Okay. This is it. So your body pretty much right now is at the point just like a vehicle that hasn't been maintained for a very long time. You drive, and then it doesn't start well. Doesn't have that power that it needs to be. Everything is shaking and stuff like that. So that's where your body is at.
Okay.
So we need to change oil, tune it up,
Okay.
make everything align, lubricate everything,
Yes.
put things, tighten the bolts, make sure everything is proper,
Okay.
and then you will feel a completely different person. So where are you at in terms of your symptoms? Basically, you're supporting skeleton, which is your skeletal system, is completely out of alignment, and this is the reason why you have so many symptoms and problems. Okay, what happens is that you walk, and when the skeleton is out of alignment, it pulls the joints, it pulls the muscles and ligaments and tendons.
Mm-hmm.
And when you do this thousands and thousands of times, what happens is that it just wears out and it creates a lot of pain and discomfort because you overuse one side and underuse the other side.
Okay.
So overuse side will cause the pain. Okay. So where you at is that the right side of your pelvis is about 1 3/4 inches lower. Okay. So it makes your right leg a little bit longer. Okay. It makes your left leg shorter. As a result, when this is out of alignment, the rest of the spine, as it is gravity-dependent structure, the rest of the spine will compensate, okay, to keep your head straight, okay? So the right shoulder, when it's compensated, when this is out of alignment here, since this is the base of the spine, which is right here, sacrum, the right shoulder is about 1 1/4 inch higher than the left side, and then your right ear is about 3/4 of an inch higher than the left side, okay? So what we need to do is basically to make these lines parallel. Okay?
Okay.
Adjust the right sacroiliac joint, which is right here. Okay? Adjust you on the right side of the lumbar. Adjust you the right side of the thoracic spine and the left side of your neck. Okay? And then after I adjust you, I'm gonna set you up with my massage therapist.
Okay.
And she will, I'll tell her what to work on you in terms of like soft tissue, which parts. Most likely you're gonna have to come back a few more times because it's been a long time. When was the last time you said you saw a chiropractor? 20 years ago?
I've been seeking for a doctor for the last 20 years.
Okay, so basically it's like imagine driving a car for 20 years without doing any maintenance. So that's where your body is at. It's gonna take some work. I mean, it took years to get your body to the point where you're at. It's gonna take some time, but we'll do the best we can to make it as fast as possible. So time is limited. Everybody is limited, so I'm not gonna waste your time. So we're gonna do the best we can to make you back to normal. Okay? Any questions?
So you're saying that right side is higher, everything's higher.
Yeah, right side, your right ear is higher, right shoulder is higher, but right pelvis is lower.
Okay. Wow.
Okay, so we need to tweak everything up to make everything straight.
Wow.
So make it look perfect, okay? So once the structure is fixed, once the skeleton is fixed, which is the structure, and then once the supporting structure, which is muscles, ligaments, and tendons fixed, then the symptoms will go away. Okay? Unless it's something else that's not chiropractic related, but most likely aches and pains, it's musculoskeletal system. All the problems come because, with most of the pain is here, because you're too young to have any other problems.
Yeah, I have stupid Kaiser, and I had X-ray, and You know, it takes every visit from one little X-ray. My neck back, they says arthritis. My lower back, they says L3, L4 is wear and tear. It's just been so many years like this. And asked for further, what can I do? They said nothing.
Nothing, yeah.
They said exercise.
I just had a patient right before you come in, 5 minutes before you come in, he has a Kaiser. And he was arguing with me saying that there are chiropractors that take Kaiser. And I told him, so it's the same thing as you would buy a Mercedes-Benz and take it to Chrysler dealership to fix it. So that's what your insurance is for.
I don't believe in them. That's why I seek.
You're not the only one.
I hate them.
Yeah, they just give you around. That's why they can afford. They just build a hospital in San Leandro. They spent $2 billion. You paid for it.
Yeah.
So they don't care about the wellness. They just wanna run out.
I pay a couple hundred a month. I do nothing with it.
Yeah, it's waste. Yeah, unfortunately. I see a lot of people after injuries that they can't do anything.
Yeah.
All right. So take a deep breath in. Put your hands down, please, towards the floor. Take a deep breath in. Out.
Oh.
Breath in. Out. Okay. Breath in. Out. Good job. Okay. Go on your side, please. Please, face me up this way. Okay. Just relax. So you're gonna have a feeling that you're gonna be falling off the table. So just relax. You're not gonna fall. Okay. Relax your shoulder.
Oh my gosh.
That was a big one. Put your feet down on the floor. Okay, sit down. Sit back here.
Fast.
Back. Okay, relax. Nice movement. Alright. Now I'm gonna adjust your lumbar spine, okay? Okay. Sit up straight. Stand up for a second. Just put this down. Okay. Go ahead and lie down on your side, face me.
Okay.
Okay. Give me a hand. Okay. Okay. Relax. Relax your shoulder. Good. Okay. All right. Stand on your feet. Let me know. How's it feel?
Wow, I mean, it happened so fast.
You feel more balanced or no?
I feel loose.
Feel what?
I feel loose.
Loose?
Loose.
Okay, sit down. Any difference when you sit down?
I might feel like a new person.
That's cool. All right, so let's go see Gail, my massage therapist,
Okay.
and then we'll go from there, okay?